means so much to you and me. Let's talk.
And here's your host, Henry Benefield.
Hey everybody, welcome to another exciting program of Let's Talk. As you just heard, I'm your host, Henry Benefield, and I'm glad to be with you folks with another great program. Listen, I was doing some research and had a personal incident that just happened, and I thought I designed something after that experience, which I think is going to help you. Many people that are, turning 65 or soon to turn 65 are confronted with some serious decisions, some serious issues in reference to Medicare. And I noticed that when this particular person I was involved with turned 65, that we really didn't have a lot of information to make good choices. So therefore, as a matter of fact, we were kind of lost. And as I talked to people in the community and I heard different reports around the city, it appears that a lot of people are not as abreast of this topic as should be. So I thought I could devise a program today to give you a little bit of information. Please get your pencils and your papers, because I think it's important, because as you get older and you get into that situation, you have Medicare, choose different medical coverages and things like that, you certainly want to be able to have information to choose the best coverage for you or your loved ones. So what I've done today is take the opportunity to invite a couple of guests. Some of the guests you want to know, some of the guests you need to know, you want to introduce to them. But it's just such a serious topic, because I'm finding out that you guys are just having information. You call to the Social Security office, and of course they cannot suggest or make decisions for you. But the bottom line is that they'll try to help you as much as they possibly can. So if you would be kind enough to get a pencil and a piece of paper, if you know someone that's about to turn 65 or someone that's about to have Medicare or something like that, you certainly want to be able to write this information down. We've got some people that work in this field. This is not the Social Security Administration, but people who work in the field of the coverages that people can choose for information on the coverages for how to do the Social Security in reference to getting coverage. Let me welcome our very first guest to the table. His name is Mr. Robert Winfred, and he's the founder director of Head Financial, and I hope I didn't mess that up. But anyway, Robert is his first name, and Winfred is his last name. We'll get all the information on the phone until we can call to get information from him after the show. And then secondly, one of our program directors here at Let's Talk, she's hosted the show several times before, and she is an expert on assisting people with making decisions when it comes to Medicaid, Medicare, all those kind of things. And she is just fantastic at what she does. And that is our very own Leslie Calhoun. So let me welcome both Robert, Mr. Winfred, welcome to the program.
Thank you.
Good to have you, man.
Thank you for inviting me.
And then we welcome Ms. Leslie Calhoun. Thank you so much, Ms. Calhoun. Such a pleasure to have you. So, guys, and I guess we're going to one of the things, let's talk about someone that is about to turn 65 and is about to enter into the Medicare world. Let's talk about what that basically means, because some people don't know you're going to have to make some serious decisions over what you want to choose for your health and that kind of stuff. So what is it they have to choose for? Let's start with you, to give folks an explanation.
Okay, first of all, Medicare is a federal health insurance program, primarily for people 65 and over, but it can be for people of any age if they have a disability and if they have certain illnesses. And regarding getting started with Medicare or understanding it, when you're turning 65, you have 3 months before the month you turn 65, the month you turn 65, and 3 months after the month you turn 65 to enroll without any repercussions.
So when you are actually choosing to enroll, what's the gamut of this thing? We're talking about Medicare. Medicare is basically your health coverage, the different. Let's talk about it, because again, I don't think people really understand what this whole foundation of Medicare is about and why you need to have some information you want to
Okay, let's talk about original Medicare, because when we talk about Medicare, which started in 1965, original Medicare basically has two parts. It has Part A, which is for when you're in the hospital. Now it also covers you, let's say you're released from the hospital and you have to go to a skilled nursing facility, or you have to go home, or even if you have to go to hospice. So that's Part A. Basically, the easiest way I tell people to remember is that Part A is for hospital coverage.
Or basic care.
Yeah, basic care, hospital coverage. And Part B is for medicals, for your doctors, your providers. That's what's often used, Part B.
Okay.
Now, Medicare was only designed to cover 80%. So typically people will receive a red, white, and blue Medicare card about 3 months before they turn 65, unless they got on Social Security earlier. We may or may not talk about that. But typically they'll be sent a card, red, white, and blue, and it'll have random numbers on it. Up until last year, it had Social Security numbers on it, but as of this April, all Social Security numbers should be removed because there was too much potential for fraud and too much fraud.
Especially using those Social Security numbers that happen so easily available on a card. Your Social Security number is there as well. Just want to retract this a little. You mentioned that Medicare A and B. Are there other areas of Medicare as well, other than A and B?
Yes. There's a little alphabet, short alphabet, A, B, C, and D. As I mentioned, original Medicare is A and B, and it does not cover prescription drugs. That's called Part D. And Part C is also better known as Medicare Advantage. That's one of the options for Medicare. And Part C is an all-in-one situation. It is Medicare, and it includes, by law, it has to include what A and B covers. So it is Medicare. But it also almost always includes prescription drug coverage, and they can add extra benefits like a gym membership, preventive dental, vision, and hearing. I do want to emphasize preventive because many people have Medicare and think they have full dental coverage, and in 9 out of 10 cases they don't, unless they are what's called dual eligible, and that's when they have Medicaid and Medicare. So those are the A, B, C, and D's of Medicare, and you have two options. You can get A and B, the red, white, and blue card, and if you just have that, remember it only covers 80%. You'll need to have either a group health coverage from your employer if you're still working, or if you have Medicaid. Medicaid is a joint program between the states and the federal government to help folks with low income and limited resources have health coverage.
And I want to get to Medicaid. You're giving us some further information on A, B, C, and D. I kind of want to stay in there just a little bit, because what happens to someone that has never done it is a little bit confusing when you said A is for hospital care, correct?
Yes.
B would be for the doctors.
Correct.
And I think you said C was all-encompassing, but we didn't get to D.
Okay. D is for your prescriptions.
Okay.
Yeah, for your medications.
Okay. So under the current Medicaid, you automatically come with what? And what would you have to choose after what is like a standard? Because it almost like sounds, and I'm sorry, don't let me lead you in the conversation and jump in there and give the interjection. What I'm saying, I know people are listening to this conversation and we know what we're talking about, but they have no clue as to what we're talking about. So I want to be like an ABC conversation with individuals.
Okay, let me go back to A again, because A is usually free if you have worked 10 years or your spouse has worked 10 years. Because basically, Medicare taxes came out of your paycheck, so really you pay for it in advance. But so for most people, it's free, not for all. Part B, which covers the doctors again and providers and other services, is typically not free, but it can be based on your income. Medicare has what's called Medicare savings programs, And based on your income, and I'd be glad to give an example if you want me to,
Yes.
the state of Ohio can pay for Part B. Part B this year for most folks, depending on their income, is $135.50 a month, and it typically comes out of your Social Security check. So based on your income, the state can pay for the $135.50. And when I talk to a lot of clients that need all their money that they're getting from Social Security, too many times I see they have that Part B coming out at $135.50, and they don't know that they can apply for free, and based on their income, the state will pay for that.
So, okay. So, Ms. Scott, you're familiar with this, what he's speaking about where they're able to get this assistance. I mean, what are some of the ramifications to them being able to receive assistance on a Part B?
$135.50 if your income is, if you're single and you make not more than $85,000, it's going to be $135.50. If you're married, and if you're married and you don't make more than $170,000 and file a joint return, then Part B is going to be that amount.
Well, what he's sharing, he's at $85,000.
Yes.
Okay. With the extra help with what is called the QMB, which is qualifying Medicare beneficiaries, and then they have the SLMB, which is specified low income beneficiaries. Those are the ones, those programs through Medicaid pay for everything that the Medicare plan does not pay for. Co-pays, co-insurance, and they also pay for the premium, the Part B premium for Medicare. So, but everybody is not eligible. You have to have a certain income in order to be eligible for these extra help programs.
Sure. But this is considered Medicaid assistance?
This is extra help through Medicaid.
Yes.
To help pay for the Medicare co-pays, premiums,
yes,
co-insurance, correct, Robert?
Yeah, deductibles.
And the deductibles.
Okay.
So if you fall into a certain income guideline, I've got the numbers in front of me.
Sure.
As a single, is you can, I think it's like $1,200. You make $1,200. I have to perform or less.
Okay.
You're eligible for what is called the qualified Medicare beneficiaries. QMB is what it's called.
Okay.
And so it will pay for your premium. That's a lot of people. I talked to a gentleman today who, because you get Social Security disability, most people are automatically enrolled into Medicare.
Okay.
But, and his income was only $600 a month, but he didn't know that he could have these extra benefits.
Sure.
So he canceled his Part B because he could not afford to pay for his premium.
Wow.
Had he been educated and known,
Which is why
that based upon his income, he's eligible for the QMB, which has a higher, gives you a little bit more benefits than the SLMB, but these are all extra help programs through Medicaid.
Okay. So, and I just want to make sure that, and this, I love what you said about Medicaid. Is this what you're referring to, or is there also something separate from Part B as well with this, or is this what we're talking about?
Well, it's related. I was just giving the income that's required for people to pay. They'll have to pay that Part B. And I also wanted to share what she was sharing is that based on that income, that Part B can be paid for. Just like she mentioned in the example that I run across often. People don't know this, and they really need, like the gentleman needs that money, making $600.
Okay.
He doesn't know that he can apply for free. And
that would be through Ms. Calhoun just said through the Medicaid system.
Yes, it can be done over the phone or with somebody with expertise like Ms. Calhoun here.
No, but the program itself is called Medicaid.
No, the program, there are what's called Medicare savings programs, and there are different levels. The first level is Medicaid, and that's one reason why it's a little confusing. Based on your income. If your income is not more than, I'm talking single, not more than about $800 a month,
sure,
then you're eligible for Medicaid. And you can also be eligible for Medicare, but you're eligible for Medicaid. If your income is more than that, say about $1,200, as Ms. Calhoun said, then you're eligible for another program. These programs pay for Part B for people who really can't afford or are deemed to not make enough money to have to pay for that.
Okay, and let's clarify, we say make enough money because most of these individuals, their income is SSDI, Social Security Disability income. So it's not an earned income as far as a job.
Okay.
This is a check that they receive through Social Security.
Okay.
You know, and the average, I think, is like $750 something of that amount per month.
So, as you mentioned, you said Medicare assistance, and you said there's more than just one. You mentioned that Medicaid was one, and there's something else. How does an individual, or who should an individual contact to find out what those different options are?
Well, I'm glad you asked that. There are several sources. They can contact someone like Ms. Calhoun, someone like myself. They can also call Medicare.
Okay.
I have the number.
At 1-800-633-4227.
1-800-633-4227.
That
Sounds just like a car deal.
That's Medicare's number.
Okay, we're going to give that number out again. That's why I'm asking everybody to get their pencils and pieces of paper available. We're going to repeat that number again, folks, so don't worry. If you didn't get it this first time, we're going to bring it back up again. But when they call the number, they're able to find out information. And I guess because, again, when the previous experience that I had, it was almost as if the attendant on the other line assumed I knew the process and the procedures, and we didn't. So this is why I'm having this particular conversation, is to help folks that when you have that conversation, you have a little bit of information to say, well, no, I'm only concerned about Part A. I'm only concerned about Part B, or what are the options in Part B? Otherwise, you're kind of out there and you're scratching your head and they're going on there and blah, blah. You're like, what, who, when, where? And some folks are quite intelligent, but on the other hand, this information is not readily available.
If I may,
Yes, ma'am.
I'd like to interject. There are so much different broad genres of help.
Okay.
My capacity, I'm considered what is called a certified application specialist.
Okay.
I've been certified through the Center for Medicaid and Medicare Services to assist individuals through the government to get their Medicare, Medicaid, and what we call marketplace.
Okay.
Then we have individuals like Robert, who's an independent agent. Broker. So he has no affiliation with any particular, you can do it from all the insurance companies that are out there. He's eligible based upon his licensure. He's been able to be licensed through the state of Ohio, through the Department of Insurance. Then we have people we call navigators who work through the marketplace, who help on a bigger scale individuals with getting on the healthcare.gov, aka Obamacare.
Okay.
But all of these things that we're doing now fall under the auspices of the Affordable Care Act, which was the product, or not the product, but the
It was a law that was passed.
the law, right, that was put into place, and we're going into our 7th year of the Affordable Care Act, the marketplace thing. So there's lots of help, but the thing of it is that over the past years, and especially this past presidency year, a lot of the advertising funding has been cut off. It used to be when of the Affordable Care Act, and I came on board in 2013 in this particular piece as far as the Affordable Care Act, there was advertising on the television.
Okay.
There were people all over the community setting up different things. And now the advertisement has been limited. The open enrollment period for people to even enroll has been, would you say, drastically cut in half?
Yes, it was reduced from, now it's November the 1st to December the 15th.
Yes.
So, but this is the affordable health care.
Yeah.
But it all falls under the same genre. There's all the insurance, because they all have, Medicare has an open enrollment period.
Okay.
Medicaid has an open enrollment period for individuals who want to get into the managed care programs,
Okay.
which are like your CareSource, your Molina, your Buckeye, your Paramount. Uh, Marketplace has, what he shared is November the 1st and December the 15th. So Medicare, now, all of them are November the 1st through December the 15th. Medicare is
Yeah, Medicare is from,
November the 1st.
no, Medicare's open enrollment is from October the 15th to December the 7th. So some of it overlaps. That's another reason that causes problems. And what happens, as Ms. Calhoun said, is that the funds were cut and the period was shortened for people that need health insurance outside of Medicaid or Medicare, because we're really talking about private insurance when we talk about that's private insurance, which is different, of course, from Medicaid and Medicare.
So the affordable health care is considered private insurance?
Affordable care, yeah, it is private insurance.
Okay. And of course, you
say that again. Say the question again. Affordable
is considered private insurance.
He's saying insurance through the marketplace. He's asking, is it considered private insurance? Yes.
I would say commercial. Yeah.
Okay.
I like the term commercial better because through the Affordable Care Act and the marketplace, they're getting assistance. Private insurance, you paying whatever that premium is without any assistance from the government.
So aren't you paying for the affordable health care out of your own?
But you're getting assistance from the government.
Yes, ma'am, I got that. I'm just simply trying to identify.
But it's different than private insurance, in my opinion.
Right, but if you have a Medicaid or a Medicare, do you still have that overall cost that you would if you were in a job and paying for health coverage?
It's when you're in a job, it's different because your employer subsidizes most of the costs of the coverage because they have the quantities of scale for all these employees. So most of it is subsidized.
Would that be considered a private coverage?
That's called group insurance. That's through your employer. Group insurance is through your employer. Private is say you don't have a job, your job doesn't offer you an insurance. Your job offers you insurance, but you choose not to accept it because you say, oh, it costs too much, And then you say, well, I'm going to call an insurance company like Humana or whatever else. They'll say,
or affordable health care.
no, it's not.
I've heard a lot of people.
They get it confused.
Yeah.
They get it confused. But individuals who just call, if you don't go through the marketplace, which is the Affordable Care Act, aka Obamacare, and you just call the insurance company, they may say your premium is $400 a month, and that's it. You have to pay that whole $400 a month.
Sure.
But if you're eligible and you go through the marketplace and all the things line up, they give you what is called a cost share reduction.
Sure.
They pay part of your co-pays, they pay part of your your deductibles, and they give you a certain amount of money for your premiums. So say, for example, you're eligible, after you go through this, they'll say you're eligible for $1,200 assistance.
Sure.
That means you can either take that $1,200 at one time, and all this has to be run through the IRS too, or you can break it down and you'll get $100 a month. What would you call it, deduction or credit or something?
Yeah, you get a cost saving credit or
Okay.
To assist you in paying.
That's a very important. That's a very important distinction.
Yeah.
Sure, and not that I want to stay on the affordable health care Obama coverage. I want to keep it on the retirement aspect of the people.
All this is up under the insurance.
I understand the
offices.
health care. I was saying when people, yes ma'am, I got you when you said all of these fall on the health care. The specific topic I'm trying to stay on is as people are making decisions either prior to turning 65 or after they've turned 65 because of the lack of information in making good choices where they get the best coverage when it comes to like Medicare, and then you, like you guys mentioned, that under B, under Medicaid, you can get assistance and stuff like that. A lot, like you said, a lot of people don't even know that.
Right.
And I wanted to kind of get that information now, and then, like I said, we can expound on additional coverage, like you said, health care from many different areas and stuff like that. But to try to empower people, again, not to be redundant, with information with that Medicare part and that age part of 65.
Yeah, I advise educate and enroll, because people who are comfortable with computer can go to sites like Medicare.gov
Okay.
and find information. But I found, and there are phone numbers they can call, but I found a lot of people want the personal service.
Sure.
That's why they come and see somebody like Ms. Calhoun, and that's why they meet with me, because they want to sit down with
Exactly.
someone that understands their situation, that'll ask them who their doctors are, that'll ask who their specialists, their medications, to make sure they're in the right plan, that's
Sure.
the right fit for them based
Right.
on their needs.
And see, that's one of the discussions that I'm talking about, because a lot of people don't know how to choose the right plan. You know, what should I be looking for in a plan? Let me do this real quick. I want you guys to get your pencils and piece of paper, because I'm about to give two numbers. Because if they're not able to help you, you already got that you can get through the Social Security Administration for information on these different types of coverages. But I also want to supply you with numbers of people that can assist you. And if they cannot assist you, they can refer you to someone that's in your region or town or whatever that can assist you. First of all, Miss, as she just identified, she's certified in this field. Miss Leslie Calhoun. So I'm going to ask her to give her her work phone number in case you guys have any questions. If you would be kind enough to say it twice, ma'am, so you guys can write it down. If you have additional questions after the show, Ms. Calhoun.
Okay, I can be reached at area code 513-389-8427. That's 513-389-8427. And I primarily assist with Medicaid enrollment. I also do some assisting with Medicare, and I do assist with Marketplace.
Sure.
So,
At least you have information that if somebody had a question, you may not be able to do certain things, but you certainly can direct them to the right way.
absolutely. Just for my brother,
Right.
Robert, we refer, one good thing about this community is that we all work together. I work for what is called a federally qualified health center. And so our health center works with the city health centers and WinMed, which is in Winton Terrace, and then Lincoln Heights. And so we all work together. And Robert, who is an independent agent, he can go just about anywhere and do all of that. So
Sure.
we do a lot of collaborating with him.
Sure.
So that's why we have Robert on the show today.
Sure. So, Mr. Renfro, if you give that information, that folks can contact you as well if they need additional assistance.
Okay, they can contact me directly, Robert Renfro, at 513-652-7353. Again, that number is 513-652-7353. That's my direct contact as opposed to one of my office numbers. I also have a website called mymedicarequestion.com. Mymedicarequestion.com, which has videos. It's an educational website that you can learn a lot. You can also schedule an appointment, but it has short videos that would teach you and answer a lot of questions.
That's
mymedicarequestion.com.
mymedicarequestions.com.
And there's also an app, a phone app called MMQ. It's free. That stands for My Medicare Question. People can download that as well. It's called MMQ. It's a free app. So that's how. That's what I want to share in terms of on the web and contacting me directly as well.
Awesome. One more time, the number for, just in case you cannot reach either of these individuals, you certainly can call the Social Security Administration, and you guys know the numbers by heart.
Okay.
And that number is?
Well, for Social Security, is 1-800-772-1213. That's the Social Security Administration.
Okay.
1-800-772-1213.
Okay. Or you can Google it, and they'll
All
ask
these can
you
be
as well.
Googled.
Yeah.
Medicare is 1-800.
And I do apologize. I meant the Medicare. I meant the Medicare number. And I'm sure you can go
But
through
these,
Social Security.
they need both of them. When you're dealing with Social Security, you need Social Security and Medicare's numbers.
Okay.
Yeah, if they're turning 65,
Yeah.
they do need to contact Social Security initially.
Sure. I'm just saying for questions,
Okay.
they may not have turned yet. I know you have to contact Social Security to file, but I'm saying in case you have questions so that when you finally make that call, you have all the information, like you empower people, this, I want to do this, I want to do that, blah, blah, that kind of
Yeah.
stuff. Because that's why we're having a show. I'm finding people, when they get to that point, they have no clue.
And then also, now, it's not only 65. This is what
Right.
you have to really be careful about saying. People, if they get Social Security disability, they're connected. They have to be in touch with the Social Security Department. So the 65 is what has been the normal,
retirement. Yeah,
the
retirement.
normal mode.
Sure.
But if you're getting Social Security disability, you're automatically enrolled into Medicare.
Okay.
And so, there's a lot of questions, but there's a lot of help. But to come to a point that you said earlier, the television commercials that you see, call this number. Do you want to join the silver sneakers? And do you want to have these things? And do you want to have that? And what happens is that a lot of our people who are getting Medicare and they're already enrolled in a plan, they see these advertisements, they call these people, and they change their plans, and the person on the other end may not have, you find this to be true,
Yeah.
might not have checked to find out, are their doctors partnered, or we call that
In their network.
in their network? Are their medications covered? And they make these decisions. And the unfortunate thing is predatory, but it ain't illegal.
So,
And
I'm sorry, go ahead, please continue.
so we just suggest that, and I tell all the people all the clients that I work with, before you make any decisions, you call somebody.
And that's why we're having the show. That's so we
Yeah.
can go over. We don't have the 5 hours to do it.
Yeah.
That we can go over what
Because-
you should be aware of before you make any final decision.
Yeah, because what had happened, it used to be, and I was sharing this with Robert a few weeks ago, it used to be that a person who has Medicare, but they get this extra help, they were able to change their plan every month. So if something happened and, I don't like this plan and I want to go to another plan and my doctors are covered, I can change once a month. Now, the government has changed it. You can only change once a quarter.
So
So that cuts it down and it makes it so much more difficult.
so that we're not leaving our audience, let's divert back just a little bit and go back to the A, B, C, and D, because you're aware of plans, but they may not understand, where do these plans apply? These coverages apply. You mentioned A, what it covers. You mentioned B, where it covers. You mentioned C. You mentioned D. Let's go back to, what are the options in choosing something that's going to serve you in the Medicare, and at what point do you have to make decisions?
Yeah, and they're not plans.
Okay.
They're parts.
So
Yeah.
parts or plans?
No, they're not plans.
Ma'am,
Okay.
I understand that.
Okay.
I'm just trying to get to the coverage and getting information to the people where, when they make choices on the correct name of the what they have to choose, what are their options? What should they be looking for?
Okay, with respect to Medicare, there are two options, so we can say they have to go down two roads. They have to pick one or the other. The first option is the A and B, the red, white, and blue card. As we mentioned again, A is for hospital and B is for medical. But since that only covers 80%, if they're down this road, they also need to pick a prescription drug plan, Part D. The
So
average
that's
cost
a
of
plan.
that is $35 for Part D, if they go down this option. Now, they need to cover that 20%, so they would need either a Medicare supplement plan, or if they're on full Medicaid, it's going to pick up at 20%, or if they're still working, their employee can pick up at 20%. So if they go down that road, they basically need three cards. They need the red, white, and blue card, they need a prescription drug card, and they need a supplement or another coverage. Now, that's option one for Medicare. Option two is Part C, Medicare Advantage. It's all in one. So it basically includes all of that.
So what are the options with would that automatically be assigned to a person, or would a person have to make a decision to choose that?
They
Option C.
A good question. They have to make they have to make a decision. They have to make a decision to enroll.
Wow.
Yeah, unless they take their Social Security early, which they'll be automatically enrolled in Medicare come 65.
Sure, sure.
Yeah, but if they haven't taken it, they have to make it. They have to take action. They have to take the initiative.
Wow.
And if they don't,
And as Ms. Calhoun just indicated, there are time spans in order to do it?
yeah, I recommend that people who are turning 65, and I advise a lot of people over 65 too, because they need to review their plans at least once a year because they change. They automatically renew, but they still should review them to make sure that their doctors are still in the network and that their medications, each plan has a different medication list, that their key medication hasn't been taken from that list.
And see, this is what's interesting, because a person will assume that if I chose this particular plan, it's consistent as long as I have it, rather than an annual review to make sure it still has what I need for me as a person, my personal health. Because you said a doctor may not be in that plan. If you don't review it, you may not know it.
Right.
So I'm sorry, please.
Yeah, well, yeah, doctor can come in and out of the network.
Wow.
So then let's talk about option two. Option two, Medicare Advantage. That's what you primarily see on TV, because you'll see advertised zero premium plans. So people would ask me, and they may have asked Ms. Calhoun, how can it be a zero premium plan for me to get coverage? The reason it can be is because our government pays these insurance companies $800 or $900 per month for enrollee. And that's why people turning 65 get so much mail, because these companies want to see if you want to change to them so they can get that $800 or $900 a month.
So, as an individual, and there are many people with different health conditions and so much stuff, as an individual, what are some of the points they should be looking for when it comes to choosing some of this?
A couple of points. They should look at if there any type of family history, like diabetes is so common, cancer might be. That can be a consideration for one type of plan. Now, let me be clear. Let me be clear. With respect to Medicare, there is no issue about pre-existing conditions, because it doesn't matter your health.
Sure.
When you're turning 65, it doesn't matter your health. Now, if you go down to option one and you want to get a supplement that covers the 20% that Medicare doesn't cover, there's just a 6-month window where you can get that, and it's guaranteed without any health issues. But as a rule, when you're turning 65, it doesn't matter your health, but it could factor in if you want a supplement, if you want to go down option one. It doesn't matter for Medicare Advantage all in one. The only question they're allowed to ask is, do you have kidney disease? And if you do,
End-stage renal failure.
it's technically called end-stage renal kidney disease. And if you do, there's typically at least a special plan for that. That's the only question they're allowed to ask.
Sure, and I'm asking, what should a person be looking for? Because if a person has a certain ailment, is it possible that the things associated with that ailment are not covered under a certain plan?
It's unlikely with Medicare, but what is likely is that, particularly with, I find with cancer and stroke and heart attack issues, they're covered, but there could be a lot of extra expenses.
So you would want to pursue and find out if there was a copay or what amount is covered that you would have to pay out of your pocket, or whatever.
Yeah, and a copay is the amount, typically the amount you pay as you go when you go visit a doctor or another healthcare provider. That's the copay. And the co-insurance is a percentage.
Okay.
But to make sure the audience knows, whatever your health is, when you first turn 65, it's not an issue in terms of you getting coverage. And in fact, you're guaranteed coverage regardless of your health.
Right, and I understand that, but to a person, 95% of the people that have this type of coverage is concerned about what am I going to have to pay for it.
Okay.
So I'm trying to help them to say, when you look at the options that you put on the table, what should I be focusing on? Like if I had, I don't know, whatever, if I went to get this treatment for vascular screening, is it zero copay?
Okay.
You know what I mean?
Yeah, yeah, that's a good question because some, particularly what you're talking about Part C Medicare Advantage,
Okay.
those are network plans. A network is a group of doctors and providers. It's not everybody, it's that network for that plan.
They're all in agreement, so to speak.
Yeah, so if you have Medicare only, there will
Okay.
be some copays for some, depending on what you need.
Okay.
One of the most common ones is the cost for a specialist. Now, let me be clear. This is for people who have Medicare. For people who are dual eligible with Medicare and Medicaid, they won't have some of these costs.
Right.
But if they have Medicare, typically, and I run across this a lot, people have specialists, and typically, the industry is going towards zero copays for your primary care physician. That's
Yes.
the trend now.
Yes.
But for specialists, it's not zero. Typically, it's $45, and a lot of people don't have that.
Oh,
That's the copay for their Medicare Advantage.
So
plan.
I should be looking to determine whether it is, now, are there such things as where specialists, there is a lesser or no copay? Is there such a thing as that?
Okay. To answer your question about what should they be looking for,
Yeah.
my first thing is your doctor covered in that plan? That's the number one.
Sure.
If you have a regular doctor that you go to all the time,
Sure.
you don't want to get into a Anthem, Blue Cross Blue Shield, or whichever one you choose,
Sure.
and they don't accept, or they're not partnered with your doctor.
So you call that in their
You
network?
want them to be providers, except there's a category, your provider and your participant, or your non-provider and your non-participant.
Explain.
So provider means we're in an agreement together. So my doctor, I'm in a plan that has agreed to, my doctor can come, I can use that doctor. My doctor is
Sure.
in that plan.
Sure.
So I would look to make sure that my doctor was covered in that plan.
Okay.
I would next look to make sure that the medications that I'm taking is covered in that plan.
Mm-hmm.
And then I would also, that's for Medicare, the Medicare Advantage plan, which he's talking about, which is Part C.
Sure.
And it's almost, in my opinion, I normally try to see if I can help them find a Part C plan, because, like Robert said, it covers a whole lot of other issues that if they just had the Part A and B, they're still having to pay that extra 20%,
Sure.
where, the company or the insurance pays 80%, but you're still held on with the 20%
Sure.
of having to be on your own.
Sure.
So those are the things. I'd make sure that the doctor was covered, and I'd make sure that the pharmacies are covered. And then you can also check for specialists to see if certain specialists,
Sure.
because even though they're a specialist, they might be participating specialists, where even though you might have to pay a copay of $40 for a specialist, if they were non-participating, you might have a copay of 80 or
Yeah, you might have to pay the whole thing.
or might have to pay the whole.
Is it possible to have a greater out-of-pocket payment where you don't have to pay $45 with like an annual deduction? What is it when they have
See,
it?
the out-of-pocket, yeah, that's with, the out-of-pocket does not run into the Medicare thing as much as it wouldn't in the marketplace.
Right. You said, is it possible not to have to pay that? Is that your question?
In other words, I know they have, let's just go to regular insurance.
Okay.
You can have basic liability, and then you can have full coverage. Now, I'm going to pay a lot more for full coverage than I am for basic liability. Do these plans, or the coverage, as you're saying, have the option that you may enter this, but if you wanted to pay a little more money, it's going to cover a lot more?
Well, In some cases, not in Medicare Advantage.
Yeah.
Medicare Advantage is popular with folks who don't want to pay a monthly premium, because that's one of the first, in addition to what Ms. Calhoun said about you want to know your doctors, your medication, your hospitals, people want to know, okay, how much is this going to cost me a month?
Sure.
So all these major companies, and I'm with a lot of them, a whole lot of them, they have what's called these zero premium plans.
Sure.
So many folks who don't want to bust their budget or who can't afford will opt for a zero, which is a Medicare Advantage plan that we've been talking about.
Sure.
So, and if it's a Medicare Advantage plan that's not a dual plan, dual means Medicaid and Medicare.
Yes.
They're going to have copays,
Yes.
because Medicare Advantage is pay as you go. That's really how you can do it. Pay as you go. Whereas a Medicare supplement on the other option, you're kind of paying in advance.
Sure. So in addition to that group of Medicare individuals, what about the ones who are able to pay more for more coverage?
Okay.
Because everyone is not in that category.
Right.
And I'm sorry, go ahead.
No, the ones who are able to pay it, they go with option one. Option one is they have, of course, A and B, your red, white, and blue card.
Okay.
They're willing to pay for a prescription drug card. Like I said, the average is $35 a month, but there's some that cost less. And they're able to pay a Medicare supplement, which covers the 20%, and those run from $100 to over $200, depending on which plans you get.
Okay.
Those plans have no network.
That's considered C, Part C? Part C?
No, that's not Part C in Medicare Advantage is the same thing. That's just a supplement. So to answer your question, the people can afford that. They're willing to pay for all of these. Here again, they're going to pay for their Part B because they make too much money. The state's not going to pay the $135.50 at least.
Sure.
They're going to pick a prescription drug plan.
Sure.
And they're going to pay for a Medicare supplement.
Sure.
And basically, they're paying for things pretty much in advance.
Sure. But they should be looking for the type of coverage, for instance, procedures. If someone is planning on in the future, planning on a hip replacement, it may not be at the moment, but they know in the future they're going to get. Shouldn't they be looking at something that could either assist them with that kind of procedure or covers that kind of procedure? And there are many, many procedures that can take place.
Yes, and unfortunately, hip and knee replacements are all too common, especially hips. So that's why whether you're in option one or option two, and I keep going back, I hope I'm not being too confusing.
You're not.
But they can call you if they have any questions they can ask.
Right, because I do all this for my clients. They don't have to do anything. I do all the research for them. And but if they know they're going to have a hip procedure, that's a good question, because if they go in the hospital and they're admitted to the hospital, they're going to have the procedure is going to be covered, but they're going to have a copay, a daily copay. We're talking back to Medicare Advantage, and they may not be aware of this. Now, to be clear, their procedure is going to be covered, but they're going to have a copay.
Okay.
And typically, that copay is going to be about $300 a day.
Okay.
So there are plans called hospital indemnity plans.
Okay.
That's separate from Medicare. It's a different type of insurance plan that they can purchase. It's optional to cover that copay. Now,
and this is what I want to get to, so that people know. You should be looking for this, because if they're in that financial bracket and then they're not aware that they should, what is the name of the coverage again?
It's called a hospital indemnity plan.
Hospital indemnity.
Indemnity just means cash. So now if they know they're going to have hip surgery, and I run across this, I ask people to let me know far in advance, because you can't just jump into one and then, I'm talking about a hospital indemnity plan.
Sure.
And then you have hip surgery the next month, you're still going to be hit with that copay.
Right.
You want to look 9 months a year ahead of time.
Right, and this is why we have these conversations, because if someone is looking at the show and they are trying to plan things around their health and making decisions where they're not run out of house and home,
they know that these options are available. That's why I tell people to get a pencil and a piece of paper as we delved into these conversations about coverages and co-pays, and there are additional coverages that you can, am I saying the right word, Miss Plans?
Not plans.
Well, I'm responding to him because he said plans. That they can get to be able to protect them where they may have to put some cash out, but not as much if you didn't have any type of insurance in that area.
Yeah, and then that opens up a whole nother conversation because they have what is called a health savings accounts where some jobs and some people put money aside specifically for, I know I'm going to have to get some eyeglasses at the end of the year, so I can put money aside. That's called a health savings account. They have those.
So that's just like a savings account.
No, it's a health savings account. I'm glad you brought that up. This is through an employer.
Okay.
Typically, basically, it's like a healthcare retirement account that you can choose. You don't lose it. Typically, your employer will contribute to it at the beginning of the year, maybe $500 or $1,000.
Sure.
Because it has to have a high deductible health plan with it. So people can contribute that. They can put this year $3,500 for a single, married $7,000. They can build up a whole slew of cash to pay for things later. That's what helps.
Things that he was suggesting.
Of course, at $3,500, you'll be empty in probably your first treatment. I'm sorry, please continue.
But there's a point that I think we should have shared earlier in the conversation when we were talking about the 65-year age. There's a penalty, and you probably can expound more upon that, Robert, for individuals who are turning 65 who don't enroll in Medicare.
So let's bring the part. First of all, when you turn 65, you have to enroll in Medicare. Is that correct?
No, you don't.
But you can, you have to enroll, but you...
Well, what happens is about 3 months before you turn 65 again, Social Security is going to send you a red, white, and blue Medicare card.
Okay.
And that's going to be Part A and Part B, as we've been talking about. Now, some people make the mistake of, I understand why they do it, because they see that A is not going to, Social Security lets them know, okay, A is not going to cost them anything. And if their income is low, they see Part B is going to cost them $135.50, so they make the big mistake of turning down B. That means they have no coverage for doctors and providers, only if they actually in the hospital. And they do that because they don't know that if they apply for these programs, the state is going to pay for that Part B. So, we wind up re-enrolling them in Part B.
And I get that part. But in the onset, first of all, you're going to get a notice from Social Security. When you get the notice, be aware that decisions have to be made in reference to Part A, Part B, and Part D. Is that correct?
No, if you get the card and you don't turn down Part B, then you're going to be covered for A and B the first day of the month that you turn 65.
So, well, this is before they turn down anything. If they just got a card, they need to respond.
Well, if they want to keep the coverage, they don't have to respond. But they're going to have Medicare. They're going to get a red, white, and blue card for A and B, but it's going to start the first day of the month that they turn 65.
Okay.
That's why I tell people to start looking at this 6 to 9 months before you turn 65.
Sure, or even a year before you turn 65.
Yeah, I want to get back to what Ms. Calhoun was talking about because the penalties can apply if you're late. Turning 65, you can enroll 3 months before the month you turn 65, the month you turn 65, and 3 months after.
But what are you saying, enroll in what? You said...
I'm sorry, you're enrolling in Medicare. You're actually enrolling in Medicare.
Okay, so here was the confusing part comes because I'm confused on this. You said once you turn 65, you're going to receive the blue and white card. That's not enrolling in Medicare.
Okay, yes it is, and I understand why it's a little confusing. It's because Medicare is good, but it's not enough. So if you just get the A and B card, you may think that you got everything covered. And remember, it doesn't include prescription drugs, and a lot of seniors don't prescription drugs. So that's not covered. And it only covers, it doesn't cover that 20%. about 67% of the people that go bankrupt is because of medical bill issues.
That's true.
Uh.
So I want to stay focused on the procedure. Once you get the blue and white card, it just comes with basic things. Those basic things are, and then once you have the basic, you need to go further by doing what?
Okay. If you had Medicaid, Medicaid will temporarily send you a prescription drug card. Will take a prescription drug card. But what you want to do is look at your options. This is when you want to find out your doctor. Find out if your doctor's in the network, because it's a different issue from before you turn 65. You got to find your doctors, your medications, your hospitals, your pharmacies. Your hospital might not be in the network.
Well, and this, like you mentioned, some of the things that we should cover. If you get a card, won't you automatically be assigned some type of company that you have it planned under? And that's the company you should check with to find out if your doctor's in that network?
Not if you were not on Medicaid. So let's assume you're not on Medicaid. You're turning 65 and you got this card. Okay, that's the only, unless you take action, that's the only thing that you're going to have. You're not going to have any prescription drug coverage.
But who pays for the prescription? Just the government?
Well, either let me put Medicaid aside. I'm not talking about Medicaid now. You have to pay for it, or either, this is why Medicare Advantage plans are so popular, because there's a zero premium plan. They don't have to pay for it.
Well, and if I could just for a moment, if we could kind of put a pause on Medicaid.
Okay.
I want to stay focused on Medicare. I do understand it's important for people to understand the availability of assistance through Medicaid. But when people first start off at 65 years of age, they get the blue and white card. That's Medicare.
Correct.
Some decisions have to be made before you even find out whether you're eligible for Medicaid. What are those things? If you get something, is there some kind of plan that comes with that, where if it's Humana, because I've heard folks say, well, the government automatically assigned this particular company to carry you, Aetna or Blue Cross, and we automatically assign. Shouldn't you investigate whatever name is on there, or do they come with no name?
Okay, they come with no names. That's why people like me, I sit down with people to pick those companies. That's how they get enrolled.
Okay, so there are no names on the card when you initially get it.
Right.
This is
red, white, and blue.
Not the red, white, and blue card.
This is why you
Part
have
A
to,
and B.
Because that's with the government. So there's no company names on it.
Yeah, it's
Okay.
just,
So there are two parts with the Social Security. One part that the government will pay, which is A and B, right?
No. A and B is Medicare through the federal government. So it's the federal government. Everything else is.
That's what I just said.
Okay.
No, you said the government pays. The government doesn't pay any of that. The plan is Part A, which is just for the facility. Part B, which is 80% for the providers, the doctors.
Who pays that?
Part B. You pay it.
You pay with your premium,
Yeah.
with that, whatever that $135 premium is. You pay for that.
So what happens when you get the card, they're going to actually be a charge assessed to the individual.
Yeah, and with the card, it's going to say that if you get, it's going to tell you that Part B has to be paid for and how much it's going to
Yeah.
be.
Sure. See, we didn't cover this, and that's why I'm trying to go back to the ABC.
Well, that was that premium, and that was that part where we said that if you had the Medicaid, they pay for that particular point. But just to kind of round it all out, if you're going to be 65, like he said, they'll send you that red, white, and blue card. That's what it's typically known as, the red, white, and blue card. 3 months before you turn 65, you can enroll. You can enroll the month that you turn 65, and then you can enroll in Medicare
3 months afterwards. If you don't, you're subject to be penalized
Yeah.
through the government.
Yeah, and related to that, this is related.
So we're going
this-
to have a part 2 of this. I see this already.
well, we're
And
talking
I'm
about
thinking about
penalties.
my guests as well. And I guess you guys, I told
Coming
Andy.
down to our last few
Yeah,
minutes.
yeah, and that's good. You guys, I hope you're writing these numbers down because I'm going to give you guys the numbers again one more time. This is one of the reasons why you have to ask these kind of questions because, power, applied power is knowledge. When you get the information, you can use it where it benefits you and understand very clearly when you pick up that phone and you get that thing in the paper, say, oh, here's this part they talked about.
Much to you and me.